So dissection of front of thigh. So I have given two long horizontal incision, one at the upper end of the thigh, second one at the lower end of the thigh, and one longitudinal incision is given connecting both the horizontal incision. First of all, skin is reflected of both sides, laterally and medially. Then superficial fascia along with the deep fascia is reflected laterally and the medially. Then which muscles you will see in the front of the thigh? Most laterally, this one is tensor fascia lata, and here this one, this is iliotibial tract. See the glistening. This one is iliotibial tract, which get inserted at the lateral condyle of tibia. Then one major muscle is the quadriceps femoris muscle, which is the extensor muscle of knee. So it includes four muscles. The first one is rectus femoris. This is rectus femoris muscle. Laterally you will get vastus lateralis, and medially you will get vastus medialis. When you retract the rectus femoris, you will get the vastus intermedius. This one is the vastus intermedius muscle. What else you will get? This strap muscle is sartorius muscle. Okay. This is the adductor longus muscle. Okay. Here you will get, this muscle is gracilis. Most medially you will get gracilis muscle. Okay. In the upper part of the front of thigh, you will get one triangular depression. This is the femoral triangle. So femoral triangle, it is bounded laterally by the medial border of adductor longus. This one is adductor longus muscle, and laterally it is bounded by the medial border of sartorius muscle. Apex is formed by the meeting point of both muscle, and base is formed by the inguinal ligament. So the floor muscle includes adductor this longus muscle, pectineus muscle. Then you will get tendon of psoas major. When you retract the femoral artery, you will get one glistening white structure which is just below it. This is the tendon of psoas major muscle, and lastly you will get iliacus muscle. Okay, what is the content? You could see from here. So you will get this one is femoral nerve, which is coming from the lumbar plexus. So it has two division, anterior and the posterior division. Bilateral circumflex femoral artery, which is a branch of arteria profunda femoris. Then you will get this femoral artery, and you will get the femoral vein. This one is femoral vein. This one. This is femoral vein. Let me show you. This one is femoral vein. So here you could see the profunda femoris artery. I will show you. This one is profunda femoris artery. This one. Okay. See, it is arising from the femoral artery itself. And you could see here it is dividing into branches. Let me retract. You could see here this artery is dividing into branches. See.